standing here today. I was born on the island. I've given birth here, and if all goes according to plan, in a few months I'll do so again. Unlike many of you, though, I was born at home with the help of a midwife. My mother was born at home, and her mother before her. My sister gave birth to her children at home with the help of midwives and lay midwives. And given the choice, I would also have my babies in the safety and comfort of my own home. This is my normal. Performing this intimate and exposed act in a public medicalized setting is not my normal. Sadly, because the majority of the past 2 generations of island women have given birth in hospitals. Hello? It might not seem normal to our community to even want to do such a thing. So I'm here to explain why I do and why it's important to me. I want to warn you that I'm a private person by nature, and that saying what I'm about to say doesn't come easily. But I personally know of island women who have been lobbying for this important service for the past 40 years and more. And I'm worried that if I don't stand up here and speak on behalf of this issue, that we'll be in the same position when my daughter is ready to give birth. And she deserves a choice, and we all do. There are those in our community who might think that having midwives is a luxury we can't afford, or worse, a dangerous and backwards way to give birth. Aren't we safer in hospitals? The truth about birth is that we aren't necessarily safer in hospitals, and a regulated and funded midwifery system integrated into our healthcare system can and does in most provinces save the system money. It also creates jobs. There are island women right now who are forced to practice their trade in other provinces because they can't do so here. I know they'd rather be caring for their sisters and their daughters and their cousins and making a difference in their own community. This government and all those before it have prevented them from coming home and being here for us. There are others who might think that this is a fringe issue and that only a handful of women want this service. But in every province where midwifery is established, the demand exceeds the ability of midwives to keep up with it. It doesn't take long for women to become aware of the advantages of midwife care. That it's safe, that it's as safe for normal births as a hospital stay, and that there are fewer chances of medical interventions, which is a polite way of saying being cut open, or having harder labors due to augmentation drugs, or the looming threat of an almost 30% chance of a cesarean section. But I would argue that this is not a fringe issue, it's a core health issue for many women and their families, and a crucial event in the building of those families and the community at large. I'm grateful that I have the privilege of living in a first world country where we have medical professionals who are highly trained and accessible, ready to help me in a case of an emergency. I have the utmost respect for what they do and for the women who feel safest in their care. But I'm not one of those women, and if I'm lucky, I would never truly need them. Obstetricians are highly trained specialists for high-risk birth, and midwives are highly trained specialists in normal, healthy births. Obviously, I feel safer knowing that if for some reason I encounter complications, that I have a safety net, but for a normal, healthy birth, I want to be attended by the experts on low-risk, healthy births. I also don't want my community to pay for an unnecessary level of care. If I have a healthy, low-risk pregnancy, I want the care appropriate to it. I don't want to be hospitalized, and I don't want a specialist. It's like asking my neighbors to pay for a prom dress for me to wear while I garden. It's not going to be comfortable, practical, or economically wise. And Health Canada supports my right to have that choice. There are a few key points in the Health Canada's national guidelines for maternal care. One, that birth is a healthy process. I would interpret that as I don't need a high-risk specialist for a healthy pregnancy. It's a waste of our community's resources and unnecessarily medicalizes what is a natural process. 2, continuity of care and setting is preferred. It means that I want to meet my caregiver and establish a relationship of trust through my prenatal care period. And I want that person to attend my birth, not whoever happens to be on working that shift and not have to labor through 6 shifts of nurses. policies and procedures are focused on the needs of the woman and her baby, physical, social, and psychological. Our cesarean rate on PEI is almost 30%. I find that outrageous. There are several midwifery practices that have cesarean rates lower than 2%, and the WHO says that the aim should be 10 to 15. Cesareans are more dangerous than natural birth. Their recovery is longer and more painful, and they can create life-threatening problems for future births as well. Intervention rates for women attended by midwives are lower than those who labor in hospitals. Now, these are all faceless statistics, but when I walk into a hospital, I'm walking face first into those statistics, and it scares me. Women and their families need privacy and comfort at all times, but especially during labor and birth. There are some women who feel safer in hospitals. I'm not one of those women. To me, giving birth in a hospital is akin to being stripped naked and laid bare in a crowded shopping mall. It's not a pleasant scenario, and not one I'm likely to get used to. Finally, giving birth represents a major transition in a woman's life. The memories and experiences of labor remain with women throughout their lives. Not only do we remember it forever, but it impacts us psychologically and physically forever. When we become mothers is when many of us become keystones in our community. We learn to really care for others and work to make our world better. Investing in strong, healthy mothers is investing in our communal health and well-being. Now, I hear this government talking about job creation all the time, when through a simple lack of initiative they denied the existence of this entire profession on PEI. I can only think it's because it's a profession that is dedicated to helping women during one of the most important events in their lives. An event that, if supported properly, can be empowering and strengthening, or has the equal potential to be demeaning and traumatic if mishandled. Maybe it's because most of our elected officials don't have to face the prospect of pushing an 8-pound living human out of their most private orifice. If they did, they might consider it a worthwhile topic to address. They might even feel uncomfortable with the idea of doing it in a public setting. In fact, I would urge each and every one of them to imagine performing this intimate and private act themselves, to think of when their wives and mothers had to face it, to think ahead to when their daughters will have to face it, and then tell me that there is any good reason, good enough to deny us the care we deserve. Why are we being forced to settle for a lower standard of care than is available to most other Canadians and recommended by our own public health agency? Why are we choosing to settle for it? Our healthcare system as a whole is in crisis in PEI, and I empathize with the MLAs and the Premier that fixing it is a very large and complicated problem. So let us help you. Listen to us when we tell you that this is a necessary service, that it will reduce costly interventions, it will reduce costly hospital admissions, and that it will help create a stronger and healthier community on PEI. I hold each and every elected member responsible for their inaction on this issue. I'd like them to take my arm when I go into labor. I want them to block my access to the midwives I know and trust, and who I want caring for me. To force me against my will into an unnecessary hospital setting, surrounded by well-meaning professional strangers. Submit me to hospital practices that mean I have a 30% chance of being cut open. I want them to stand next to me as the fear of my surroundings make my labor painful and frightening and last far longer than it needs to. I want them to hold my hand as I deliver my baby and tell me why I can't be at home, where I feel safest. And that even though I'm built for this, that I'm a healthy woman with a healthy pregnancy, that my community has to pay for care that I don't want or need. And explain to me why they can't do anything to make it better. Thank you.